Hi, Bridget. Please fill in the information for the vet.
Lola is a previous patient here at Ajax Veterinarian Hospital. We are located at 1715 Marie Street East in Ajax, Ontario. I'm just going to go ahead and clarify with Lola's owners that the patient information hasn't changed. Your address is still currently 523 Coldsburg Street, Ajax, Ontario, L1X 8V3.
Correct.
Your phone number is still the same, 905-723-5533.
Yes.
Lola is a Parisian domestic long-haired cat, white in color. She is a spayed female.
Yes.
Her birthday is March 23rd, 2007, and she would be 8 years old now.
Yes.
I'm going to go ahead with the physical exam, but first I'd like to weigh Lola. For Lola's symptoms, you wrote down that you've noticed weight loss, increased appetite, increased activity, lots of drinking and peeing. Is this correct?
Yes, it's had me very worried.
How long has this been going on for?
I'd say about a year, but it's gotten worse the past 3 weeks.
After palpating Lola, I've noticed that her thyroid glands are enlarged. She is also very skinny. She's actually extremely underweight. Lola has a fast heart rate. A normal cat's heart rate is about 150 to 210 beats per minute, and Lola's is 225 beats per minute. I would like to do a blood smear test checking Lola's thyroid levels. If her thyroid level is enlarged, her T4 levels will be elevated. However, age and other diseases can suppress the T4 levels, so we can do a T3 suppression test, which is when you give your cat a tablet 2 times a day for 2 days before the blood test. This test will tell us if Lola has hyperthyroidism, where the T4 test may not.
My budget is not the best right now. What would you suggest?
I would suggest starting with the blood test, checking Lola's thyroid levels, and then we can see what they are and what comes back. And then we can go from there and figure out what you can afford and work with that.
Okay, that sounds perfect. We will do the blood test first then. Thank you.
Hi, Amy. I was actually just coming to look for you. I need your help, please.
Yeah, sure. How can I help?
Well, Bridget and I discussed what I found on Lola's physical exam, and she's agreed to do a T4 blood test. Can you please take Lola to the back and complete the blood test for me?
No problem, doctor.
Hi, Bridget. We have received Lola's test results, and she is positive for hyperthyroidism. We would like to keep her overnight to monitor her and get her medication she needs right away through IV.
In order to treat Lola, we will be sending her home with a prescription called methimazole. Since hyperthyroidism is when the gland is producing too much thyroid hormone, it needs to be controlled. Methimazole inhibits the production of thyroid hormones. The prescription given is 2.5 milligrams of methimazole every 12 hours. Tablets come in 5 milligram dosages. The owner will be required to give half a tablet every 12 hours. A wet diet of prescription YD diet will be sent home with the client to feed Lola. The wet diet will be easier for Lola to swallow and add her medication into. This food is simply not a medication, but how it works is easy. Since the thyroid needs iodine to make thyroid hormones, it has a reduced amount of iodine in the diet. This does not allow the body to overproduce thyroid hormones. All right, Bridget. Lola is almost ready to go home, but we just need to go over these discharge sheets with you.
Anything that will make this easier on my Lola.
So for Lola's medication, she must take the medication prescribed to her as directed.
That's fair.
When it comes to monitoring her condition, take note and contact us immediately if any of her former symptoms come back. Take into account that she will certainly not be back to herself for a few days. Just take your time with her and ensure she stays happy, and she will make a speedy recovery.
Okay, thank you so much for making this easier for both Lola and myself. Goodbye, Bridget. We'll see you later.
He wants to dream like young man with the wisdom of an old man. He wants his home and security. He wants to live like a sailor at sea.